All right. Welcome everybody. We're going to start in about 1 minute. Sorry for the confusion. We had a Zoom conflict we did not realize. Thanks for hanging in there. This is going to be more organized than the last few minutes probably have been for you, and I apologize. We are recording, and we're going to make the recording available to anybody who wants to view it after.
All right, I think we'll go ahead and get started. You think, Stephanie?
Yes, perfect.
Okay. All right, well, y'all made it to the correct link. So welcome everybody. Thank you for joining us for our Hill Day recap and advocacy update today. So I am Cindy Blackwell. I'm the TNOTA Federal Legislative Coordinator, and I'll let my co-presenters introduce themselves as well. Go ahead, Stephanie.
Hi, I'm Stephanie Lancaster. I'm the current president of TNOTA and one of the people with boots on the ground at Hill Day. So here to kind of share about that.
And I'm Rosemary. I am the Advocacy Committee Chair for TNOTA.
All right. So here are the learning objectives that we are going to cover today. We hope you'll be able to walk away from this presentation kind of being able to discuss at least one of the current legislative issues that we are facing as occupational therapy practitioners and students in our state right now. We want to be able to share information about experiences, some kind of takeaways, and some questions that we had about Hill Day and give you all the opportunity to reflect on the same. And then we hope you'll be able to identify at least one actionable step you can take related to advocacy to complete kind of as a follow-up to TNOTA's Hill Day event. So we're going to talk about Hill Day in 3 phases today. So we're going to talk about the things that we did to prepare for the Hill Day event that happened back in March, just about a month ago. Stephanie will talk about the actual event. Like she said, she had boots on the ground. She was there, part of all of the events. And so she'll kind of talk about what that looks like. And then Rosie will talk about the follow-up and the action steps that we as an organization and as individuals can take in the aftermath of our Hill Day. So I'll begin by talking about what we did to prepare for the Hill Day event. And it was a multifaceted approach. So we really spent a lot of time throughout the year. TNOTA spends a lot of time tracking legislation at both the state and federal level that it has an impact on occupational therapy. But since we're talking about our TNOTA Hill Day here, we'll talk about statewide legislation. So we looked at different bills that were coming up in our state legislature. We met with our lobbyists several times. We made some connections with other key stakeholders, and then we kind of put together a call for action for our membership and for OT stakeholders. So I'll talk a little bit first about bill tracking. As I mentioned before, TNOTA actively tracks legislation and regulations that impact occupational therapy at both the state and federal levels. At the federal level, this happens year round. So we're in very close communication with AOTA about legislation, policies, regulations, payer changes that impact occupational therapy, and then we actively communicate that to our membership. But at the state level, our state legislature is typically in session from January until usually about mid-April, sometimes extending into May. And so we're really active at the state level in the beginning part of the year. We do a little bit of preparation in the fall to kind of look at what the legislative climate is going to be going into the new legislative session and get our ducks in a row with what our priorities are going to be for the upcoming legislative session. So this year we have watched several different bills and have taken action on some. So I'm going to briefly talk about what these bills are. And I'll actually pop over and show y'all the bill tracking website on the Tennessee government website so y'all can see what that looks like. So one of the big bills, and we put out a call to action about this probably about 2 months ago, is what's called the Butler Bill. It's House Bill 0387 or Senate Bill 0474. And this bill would actually prohibit healthcare providers from asking patients about their access to firearms. So this was, needless to say, a pretty big concern for us as occupational therapy practitioners because thinking about things like suicide prevention or just working in the mental health field or even providers working in home health who want to know whether or not there's a firearm in the home that they're going into. The Butler bill would have made it illegal for healthcare providers to ask about firearms in general. Thankfully, this bill has been deferred until the next legislative session, 2026. So it's not something we have to actively fight against currently. I don't know the reason why it was deferred, Stephanie, do you? I don't think we learned.
Yeah, I don't know that they officially said. I think they just kind of acted like they had bigger fish to fry.
Yeah, sometimes bills get deferred when there's not enough momentum behind them, or yeah, if there are other bigger things going on in the legislature that session. So that bill has been deferred, which is good news for us in the short term and something we'll keep on our radar for next year. Another bill that we have been tracking and keeping an eye on, it was called the Freedom for Family Care Act. So in short, this bill would create a mechanism for qualified family members to be paid as caregivers for their family members as part of like the insurance disability funding. Right now, a lot of family caregiving is unpaid, and so this would introduce a path forward for a caregiver, a family member to be a paid caregiver for a person with a disability. And then the Katie Beckett Act, those of you who work in pediatrics might be familiar with the Katie Beckett waiver, which provides funding for institutional settings and for like outpatient therapies and medical expenses for people with disabilities. And then this act would extend Part A funding to also be used in home and community settings, not just in institutions or other kind of brick and mortar settings. The next few that we tracked were something that's always on our radar is TennCare modernization. So we're always looking at reimbursement rates in our state. We can't control the commercial payer reimbursement rates, but we can tack on to any kind of advocacy or legislative action related to TennCare and advocate for increased reimbursement rates for therapy services. The TennCare Modernization Act would kind of look at TennCare reimbursement rates for certain services and seek to align it with the rates that Medicare pays for those services or what commercial payers pay, whichever is higher. And so that is currently going through the legislature right now. Another bill we're looking at is one that would require school districts or LEAs to provide 10-day notification of IEP meetings and would require the LEA to provide copies of draft IEPs and assessments to caregivers, family members, 48 hours in advance. So a little more, I guess, teeth behind making sure that that 10-day notice is given to families in the state of Tennessee before an IEP meeting. And then we monitored a few other bills, including the OT licensure board was set to sunset this year. So I don't know how many years, every few years, legally, the state has to look at, do we still need an OT licensure board? Is it still relevant? Is this still something we need to fund and put government resources towards? And the answer is almost always yes, but good news, the OT licensure board legislation is passed. So we have an OT licensure board for the next 4 years at least. That was pretty much a given, but still something that we monitored just to make sure. We also looked at some like TennCare reporting reform and some temporary coverage. We looked at speech therapy had a bill to expand coverage for stuttering. And then there was a bill up for state employee leave for family care. So things that are maybe more indirectly related to occupational therapy, but still things that our lobbyists track for us to make sure that if it's something that even is tangentially related, we know what's going on. I'm going to pause actually and show, I've got these bills actually linked in the slide, but I'm going to show what it looks like when you navigate to the Tennessee government website. You can see this is the website of the Tennessee General Assembly. This is the Katie Beckett bill that I talked about. I'll pop over to I think the other one I have up is the Butler bill. Oh no, this is the LEA 10-day notice bill. So if you click on those links in the slides, or you can go to tn.gov and you can kind of poke around on this website, but you can see all of the actions that have been taken related to this bill on both the Senate side and the House side. You can look at a summary of the bill, kind of a quick snapshot of what the bill is proposing to do. You can look at whether or not it has any financial implications. You can look at how individual members voted. You can look at who the sponsors are here on the left side. So if you want to advocate strongly for or strongly against a piece of legislation, you can contact these fine folks who are the sponsors of a given bill. You can also use this website to find your legislator. There's this little button up here, and you can type in your home address and it will show you who your representative is in the House and who your state senator is. And you can talk to that person and try to influence their vote. It's really important. So just wanted to give a little plug that this information seems kind of convoluted. It seems hard to find information. It's hard to read the legalese if you don't know, but this is a pretty easy to read, pretty friendly to navigate website where you can go and find more information on the bills that are going through the Tennessee State House and Senate if you are curious. All right, I'm going to go back to my slides. I talked through all the bills that we're currently tracking. So that was kind of the first part of the preparation, right? That's something that we do as soon as the legislature is in session, as we look at what bills are coming up to be introduced and for votes. Stephanie took the lead on this, but we throughout the year meet with our lobbyists at Capitol and Fifth Public Strategies. That's a picture of Courtney Atnip, who's our lobbyist working with TNOTA. Their firm tracks legislation for us as well, and they have all the inside knowledge on who we need to talk to and who's friendly to occupational therapy and who might need more convincing to come to our side. They give us kind of the rundown of all the currently tracked bills and the possible implications for occupational therapy. And as we're meeting with them, we tell them our legislative priorities, which some years we have a lot on our minds and we're trying to accomplish, and some years we're just kind of looking to see what gets introduced. But as we talk through TNOTA's legislative priorities, we are kind of asking ourselves, where should OT be included? So if there's a list of healthcare professions that are on the docket to be have their TennCare reimbursement increased, should OT be on that list? Probably. We have gotten OT included in bills in the past that became law with relation to suicide prevention and non-pharmacological options for intervention for pain, all kinds of different things. And we do that because we pay attention to the legislation and we say, okay, OT needs to be in that list of providers. We also ask ourselves what legislation might pose a potential threat to our profession. So a bill related to firearms isn't necessarily in every occupational therapy practitioner's day-to-day life, but it could definitely be a threat to our profession if we kind of don't advocate for what the harmful implications of that bill could be. And we want to make legislators aware of sort of what's at risk if that type of legislation is passed. And then we ask ourselves, excuse me, where our interests are aligned with other stakeholders. So can we partner with the speech therapist or the physical therapist? And you will hear more about it in a minute, but our lobbyists also represent the Tennessee Disability Coalition, and they facilitated a connection between TNOTA and the Tennessee Disability Coalition that spans back a few years, but in this case, it allowed us to kind of tack on to their day on the Hill and really get occupational therapy out there and active on the Hill. So TNOTA reached out to the leadership at the Tennessee Disability Coalition. Like I mentioned, Capitol and Fifth represents both groups, and we've connected on various issues over the years. But the Tennessee Disability Coalition has a really well-established network, and they're very well organized and well resourced for many events, including their Hill Day. They've done one for several years. It was, Stephanie, would you say, a learning opportunity for TNOTA? It was something that this year we kind of, tagged along with them and we learned and we took notes and we kind of saw how a Hill Day runs in the state of Tennessee and sort of what makes it successful and what might contribute to challenges. But it was really beneficial for us to be able to come alongside the folks at the Tennessee Disability Coalition and the disability self-advocates that were there and the family members and the caregivers and all the different stakeholders. We had a lot of things in common with them legislatively, as you can imagine. So things like increasing funding for Medicaid for TennCare, the Katie Beckett waiver, the family caregiving options. So there are a lot of places where our interests are aligned and it makes sense for us to partner together. And then the Disability Day on the Hill is really impactful and memorable. It's not that often that you have, dozens and dozens of disabled people walking through the halls of our state capitol, and pairing occupational therapy stakeholders with disability stakeholders kind of increases our visibility and our connection to the population that we serve and the work that we do. So that worked very much to our advantage. And then kind of the last step that we took to prepare for our Hill Day was putting out a call to action. So the Tennessee Disability Coalition provided the infrastructure for Disability Day on the Hill. And then TNOTA organized our own groups of, different students and practitioners who are interested in joining. We sent out the information to our membership. We coordinated with OT and OTA programs and their SOTA groups. The Tennessee Disability Coalition did a Disability Day on the Hill webinar to kind of brief everyone on what each group's legislative priorities were prior to that day on the Hill. They facilitated a networking opportunity, which I think Stephanie will talk about in a moment. And they also have a really fantastic website with a lot of frequently asked questions and how-tos for advocacy training. I'll show you that website in just a moment, and they sent out some information via email as well. The TDC also did an in-person advocacy workshop, which I thought was a really unique opportunity to do some hands-on training. So I'll show you quickly. This is the Tennessee Disability Coalition's website. It's just tndisability.org. And this is a landing page they have called Advocacy 101. And so it goes through things like how to schedule a meeting with your legislator. How do you prepare? What should you do? Think about examples of stories you might want to tell them from your own life. It's got a bunch of great handouts. It's got links to their policy priority document for 2025, and then an advocacy toolkit for things like sharing your story on social media, how even as basic as how to write a story, to kind of talk about the impact of a specific piece of legislation and what that might mean in your life and your work and your profession. So this is a really robust set of resources here. And again, something that TNOTA is taking as a learning opportunity. But it's been really great to kind of partner with the Tennessee Disability Coalition and learn from them, and kind of get some inspiration from the robust set of resources that they have put together. And with that, I'm going to go back to my slides. And I will turn it over to Stephanie.
Thank you, Cindy. I appreciate that. I'm really excited to talk about this. When I first decided to try to work my way onto the board for TNOTA, learning more about advocacy and legislation, both at the federal and state level, was really one of the reasons behind that. And so I was really happy that we were able to get the lift on this event for this year. And I think that we will try to do that again next year, hopefully with a little more notice and a little more experience under our belts. And so I'm happy to share some of what we did on Hill Day and then some of what I learned. And I was very transparent to anybody that I was talking to, saying that I was going to go to Hill Day. And I said, look, I'm just there to learn. I'm not an advocacy expert. I'm an OT practitioner and just trying to learn how to better serve our clients and prospective clients and to help others through our profession and our association do that. So again, like Cindy said, I really want to tip my hat to the Tennessee Disability Coalition. Very well organized, and they did so in the way that makes it look like it's pretty effortless, though any of us who've ever organized anything know that it couldn't have been effortless, but they made it very smooth, and that's there's a lot to be said for that, I think. So the day before the actual Hill Day, which turned out to be Tuesday, March 11th, the Disability Coalition hosted an event, sort of a social networking event, which they called their community party at a local brewery in downtown Nashville. And you can see on the slide, the photo on the right is the three of us that are presenting today. Cindy and Rosie and I got to attend that. There were a lot of people there with disabilities and a lot of family members, family and friends of people with disabilities, and then a lot of professionals and people who are able to work in the sort of disability space. And that was a really The energy of that I thought was really good to get caught up in. In the photo on the left of the slide, you can see I put an image of just one of the, I think, 25 landmarks that were lit up blue in what they call coalition blue across the state of Tennessee. We had all the way from Memphis, West Tennessee. The bridge was lit up blue, if you're familiar with West Tennessee, all the way to things in the east. And then, of course, in our state capitol, we had some blue on those buildings as well. And you can see the state capitol there lit up in blue. So that was one cool thing that the Tennessee Disability Coalition had really queued up for us. And I've noticed a lot when there's different colors on landmarks and things around, and I'll always Google or try to find out what's that all about. And so maybe somebody did that and found their way to Disability Day on the Hill and what's that all about. And maybe it struck a chord with them, and that's something they want to learn more about or even get involved with in the future. So I think that was worth the effort for that. Now, actual Hill Day. This was on Wednesday, March 12th, and started very early in the morning for some of us. And we did ask people to set up appointments with their own representatives or any representatives that they wanted to meet with. And so that was kind of part of that planning phase. And I had some advice from basically the website that the Disability Coalition has kind of a walkthrough process about how to connect with your legislator. And then I also spoke with our lobbyist and got some advice about that. So the reason that a few of us started off really about 7:15 that morning was because that was the only availability to meet with one of the main people that we wanted to meet with, which was Representative Ed Butler. And he is the guy that proposed that firearm access law and or the bill for that. And we really wanted to meet with him for two reasons. One is to gauge his understanding or awareness of OT and how that might be connected to the bill. And then my reasoning for wanting to speak with him is to find out what the impetus was. How did that idea for the bill get started? And we were able to meet with him. He only had a 7:30 a.m. meeting time, and we took it. So I'm saying we, and so I want to acknowledge the two people that were with me, and that was Kaylin Lawrence, who is one of our mental health committee members. She previously was a mental health committee co-chair and now is a member and does a lot in the mental health space in our association and in our state. And then she had an OTA student with her by the name of Chris Min, who also was from Nashville State Community College and was doing field work with her. And so he also attended. So we sat down with Representative Butler, and the first question out of our mouths, and this held true for the other legislators we met with during that day, was, have you heard of OT? And any students on this call or new practitioners, people who've recently entered the field will recognize this as sort of a battle cry that you heard probably ad nauseum during OT school. You will give an elevator speech in a unique way, specific to the listener, a million times or more in your career. And that was never far from my head on Hill Day because we did it over and over and over, starting at this first meeting. And I actually was pleasantly surprised in that everyone we spoke with was at least a little bit, if not a moderate amount, familiar with OT. But as happens a lot in our profession, everybody who had an understanding of it just had a partial understanding. So we did get to advocate by educating, always a big thing in our profession, as you all know. So we started off and talked to Representative Butler. He has a family member that is currently getting OT, and so we had that in. That was good, kind of opened the door. And but that person is not getting it for anything related to mental health, which really was the angle we were approaching our concern and our desire for involvement in relation to the firearm access bill, or the Butler bill, as it's been nicknamed. And so we talked to him about that, and Kaylin did a really good job in bringing stories from her clients. She owns a private practice in mental health, and she actually talked about a couple specific scenarios that her clients had expressed a desire for her to talk to them and really ask them about their access to firearms and ammunition when she had concerns about their safety or the safety of others in relation to them and their care. And so giving those personal stories seemed to be a really good way to connect. We weren't there to lecture or act like we knew all the details or had the answers to everything. By no stretch were we there to do that. Instead, we were there to share our perspective, represent what the profession generally is might be thinking about in terms of how that relates to our patient care and our ability to ensure safety and truly serve the citizens of the state. And then also we wanted to get some insight, if possible, as to what the representative was thinking. And so I did ask him if he minded sharing how the idea for the bill came to him. And he did share that it was a couple of his constituents who actually were personal friends of his from his district who had been to get a physical the fall before. And each of them separately had been asked by their provider, do you have access to a firearm? And no background evidently was provided as to why that question was being asked. And both of those individuals were concerned. And they reached out to their friend and who was a legislator and said, I don't think this is right. I didn't get a good feeling from that. It seems like they were, invading my privacy. And so we talked to the representative about how we understand that that could have been their takeaway, but why that question was really probably being asked and why it's important for it to be asked. And during the meeting, he did tell us that an amendment was being added to say that if the provider felt that someone's safety or the safety of others was potentially imminently in danger, that it would be permissible for the provider to ask that question. And so that was a shift that had been going on basically because of input like he received from us and others too. So we felt that was a successful meeting. He didn't say he was going to scrap the bill or that, everything we said was right, but he did, I think, listen, and we listened too and learned. Now, we did have three other appointments with others, and you can see in the photo here, that's the three of us representing TNOTA, meeting with Senator Akbari, who represents the Shelby County or Memphis area. And she was I knew right when we stepped in her office that she was kind of one of us, that she had a big collection of magic markers out on her desk and like a million colored sticky notes. And you can kind of see that photo was taken in her office, and she had really cool artwork by local artists. And she just seemed like a real down to earth person. And she right away told us she loves OT. She has a family member that's getting it as well. And she felt like it was one of the best services that that person had gotten in multiple settings. And, it was just easy to relate to her. And she then told us that she was going to propose a bill in a subcommittee hearing later that afternoon. And she told us, make sure you go to that. So that was kind of cool to get that invitation. And it was her idea to take the photo. And I thought that was really nice too. And we met with two other representatives, Mark White and John Gillespie. And one of them was just very vaguely familiar with OT, and the other one was, I would say, like 75% familiar and seemed like a big fan. And he, in fact, told us a personal story that related to the Butler bill as to why he is very opposed to it. which wasn't exactly in line with what most of his party, I think, was thinking. And so we were pleasantly surprised to have that open conversation with him. So all in all, it was a really successful set of meetings. We did also attend two subcommittee hearings. One was very observational, and we were just listening and learning how everything works and how the communication, the back and forth works. And during that, I made some notes of people, of representatives that I wanted to email later and just thank them for their stance. And I did. And both responded very favorably. And I got my OT, what is OT plug in that way too. And the other one was really cool because that was the one that Senator Akbari talked about her proposal related to the Katie Beckett bill. And there was a family there who, the father of the family that had a child with a disability, the dad testified, and there was not a dry eye in the house. And that motion through the subcommittee passed with no opposition whatsoever. So again, the theme being the power of story and that personal connection, and that really, really made the difference. In between those subcommittee hearings and the specific meetings with legislators, we spent some time in kind of a community gathering room that there were a lot of people that were there for Disability Day on the Hill, and we saw some familiar faces and met some people. There was a letter writing station and some refreshments and lots of information, again, a learning opportunity for us, and that was really cool. I also want to mention, and I think this is on the next slide, if I'm remembering correctly. Yes, we had some students there representing TNOTA, and I was really proud to see sort of the next generation of OT practitioners that had been able to take time away from their educational program and show up and represent. Now, they had their own meetings with legislators throughout the day. We were just in that common room together, but the energy was really high. And I talked to them before, and they said they were very ready to give their elevator speech and listen, which is also very important. And I wanted to ask if anybody else that was in attendance at Hill Day is on this call tonight. Okay, that's okay. They sort of paid their dues, I think, but I did want to give them a chance to speak. If you got an April 1st TNOTA newsletter in your inbox last week, you saw that there was a link to an article on our website that has some quotes from some of the students who did attend Hill Day. And so there's more information there about that. But it was a learning experience for all of us, and I'm really grateful to have gone and to have gotten the opportunity to connect with other people from the OT profession, and then also people involved in that advocacy work, whether they're our representatives or at other allies and advocates in that space. And so now I'm going to turn it over to Rosemary, who is the chair of the TNOTA Advocacy Committee.
All right, thank you, Stephanie. So following up from this update, there's a lot of ways that we can incorporate advocacy, both on an individual level and through TNOTA. The first thing I'd like to emphasize is one thing that we did learn through our experience with Hill Day was the importance of registering to vote, because the legislators are more likely to meet with their constituents. And so they emphasized that was like a good starting point. If you haven't done that, to just go ahead and do that. And it's an easier way to get your foot in the door from an advocacy perspective. Second, we kind of touched on it earlier, is learning who your legislators are. So you can go again to that website. I have it again here on the slide. Learning who your legislators are so that when items come up, you know where to turn, or you at least know how to find where to turn to voice your concerns or your thoughts, things like that. And then next, I would say just knowing that there's resources out there can be very helpful. I think advocacy can be overwhelming, and you think legislation, it's confusing. Sometimes the words are not familiar to us as practitioners. And so, one of the great things about the Tennessee Disability Coalition is that they do have those advocacy resources. So you can go there to attend webinars on advocacy items. One of the things that leading up to the Hill Day that they went over was just like basic uh, vocabulary associated with legislation. So you're more familiar with what people are going to be talking about, which can be really helpful to learn the language so that there's less of a fear and more of an understanding of what is going on. And then again, tracking the bills, they also have some information on how to do that, or track ones that are more pertinent to your setting. Again, OT crosses like a variety of settings. So some might be more meaningful to you than to others, just depending on what setting you're working in. Obviously, as OTs, we tend to be very enthusiastic about our profession. And so we care about all of OT, but sometimes having that personal connection with the bill can really help you to take action steps forward. And then once you know who your legislators are, it's helpful to meet with them during the legislative session, but it's also, you can meet with them when they're not in session. And this is going to be in a less pressured environment. And they take meetings via phone, they take meetings via email or Zoom. And a lot of these are not necessarily you advocating for a specific bill or a specific piece of legislation. One of the things that they did emphasize was that a lot of advocacy is just building relationships and building, again, like an understanding of what occupational therapy is. So our legislators are not occupational therapists, we know that, but a lot of them are not in realms that are going to interact with OT a lot. And fortunately, it sounds like the ones that Stephanie met with at least had a baseline understanding. But even just broadening their understanding can really be beneficial from an advocacy standpoint. So they are usually very willing to take meetings when they're not in session. And so that can just be a great way to just put a face with a profession. Like they've met with an OT before, they may not know a whole lot what it is, but then if some type of legislation comes up, you can circle back and you'll be a familiar face or a familiar name. And then there's a video that is linked here that is a step-by-step of showing you how to schedule a meeting with your legislator. So that's just an additional resource to help you out from that standpoint. And then also staying up to date on current legislative items. We send out our newsletters, and then also we send out legislative updates as well. So that's a good way to just stay up to date, keep things on your radar, especially throughout the year, so that when it comes down to legislative session, not all the things are entirely new. And then there's a text number that you can use to get updates and alerts to your text messages. And this was, I also believe, through the Tennessee Disability Coalition. So that's another way to just stay up to date. Now, kind of switching gears through TNOTA, the best way to be involved in all the advocacy initiatives is to become a member of TNOTA. Part of TNOTA's role is that we do partner with other organizations, and we also have our legislative representatives who do this work for us to help get us involved to track these things. And so that's one benefit of being a TNOTA member, and membership also supports our ability to have those resources to advocate for our profession. And then now that we've gone through a cycle of Hill Day, we're a little bit more familiar with it. Like Stephanie said, we had kind of approached this as a big learning opportunity. And so now knowing what we know now, we're better prepared to prepare for a Hill Day next year. And so look forward to Hill Day next spring. And then TNOTA conference is in September. So attend that. That's a great way to stay up to date with things going on in the profession. Joining a committee in TNOTA is a great way to advocate. Asking questions and also sharing ideas. I put contact information up here as well. We welcome questions and ideas from anyone, especially like I said, OT has a wide variety of practice settings and experiences. So keeping us in the loop is a great way to advocate. And then also, TNOTA puts out a lot of continuing education events. We do several throughout the year specific to advocacy. In October, we do a yearly advocacy update. So that's one that you can look forward to, but also we'll have probably another two throughout this year related to advocacy that can just keep you in. Is another resource that was put out by the Tennessee Disability Coalition, I believe. And then this is, they put out workshops throughout the year related to advocacy. I've attended, I think, 3 of these up till this point, and I would say they're very educational. I've learned a lot. And like I said, some of it is just refreshing on like what some words mean or like ways that you can advocate that maybe we haven't thought about before. So they are not terribly long and they're very informative if you're looking to um, get more involved in advocacy work. Any specific questions related to things we've discussed? I believe Stephanie put some of those links in the chat and information in the chat if you want to directly go to those websites. But any questions, let us know.
Any thoughts or anything else that you all are seeking that we could work on putting together? We are always open for that information or ideas or questions. And so you can reach the committee, the advocacy committee at advocacy@tnota.org, or just email the regular TNOTA inbox at admin@tnota.org. So you can see those. And you also, if you're just more of a phone call or text person, you can do that too. There's the number on the screen, 615-669-0524. We will definitely be having another advocacy update in the fall to kind of wrap up the 2025 legislative session. And so please be on the lookout for that as well. Thank you very much for attending. And I do want to share that we will send out a follow-up email in the next week that will have your CE certificate as well as some of the information so that you can have kind of a handout takeaway on this. Thank y'all for being here.
Thanks, everybody.
Thank you.